Hey folks, my name is Mo Amir, and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight, we're going to do something really special at the end of the show. I promise you won't want to miss it. We're also going to talk about BC's official opposition party, the BC Liberals, and why they might not be called the BC Liberal Party for much longer. But first, about 1 million British Columbians do not have a family doctor. Emergency rooms and primary care facilities have been experiencing temporary service reductions throughout the province, particularly in rural BC. Doctors and nurses are experiencing severe levels of burnout, and the entire healthcare system feels like it's deteriorating. But what about cancer care in BC? We know that timely treatment can be a matter of life and death when it comes to cancer, but how have longer wait times and constrained service capacity in the overall healthcare system affected BC's cancer care services? Our first guest tonight has been looking into this. She's an award-winning journalist for Canada's national newspaper, the Globe and Mail. Earlier this year, she was also named one of Vancouver's most powerful people by Vancouver Magazine. She is Andrea Wu. Andrea, so nice to see you.
Thank you for that intro.
Absolutely. You are one of the most powerful people in this city.
I wanted to point out that I beat the Coyotes, the Stanley Park Coyotes, by like a dozen spots or something.
You earned that win.
Thank you.
Yeah, you're way better than those Coyotes.
I felt so too.
I want to get a little serious here, though. I do want to talk about cancer care in BC. We know that the healthcare system feels like it's really constrained. Capacity is just not meeting the demands of people around the province in terms of their healthcare needs. But I feel like British Columbia has always prided itself for the type of service it provides for patients with cancer. What are we seeing in terms of cancer care? Are we seeing longer wait times? Has this been affected like the rest of the healthcare system?
Yeah. So we can break down what's happening in cancer care into three main areas, I would say. The first is that because of capacity issues, so a shortage of healthcare workers and of treatment infrastructure, we have seen growing wait times. Mm-hmm. So people are waiting longer than the recommended amounts of times for things like getting their medical imaging or like getting to see an oncologist or getting to start radiation therapy. So all those wait times are growing. The second thing is that cancer care staff are burning out and are very stressed out and have record levels of disengagement, which you could point to any healthcare worker after 2.5 years in the pandemic. But this was something that had happened long before. And in fact, there had been a survey, an internal survey conducted just before the pandemic where BC cancer physicians self-reported the highest levels of stress and burnout and disengagement among all of their peers.
So this was before the COVID-19 pandemic.
So it was 2019, this survey was done, and they compared them to cancer staff at other cancer centers across Canada. Highest levels of burnout, stress, disengagement. And then the third area broadly where I would say we're seeing some changes in the cancer care system is that it's what past presidents of the BC Cancer Agency would describe as a decline in performance. So, for example, BC used to lead the country in 5-year relative survival rates for several major cancers. We have sort of fallen in performance while other provinces have improved their outcomes. And so we've gone from being the best in the country, according to these past presidents, a model that others looked to and emulated, to being somewhere in the middle of the pack.
Wow. So how did this all happen? Because as you said, we did have good performance when it came to cancer care treatment in this province.
So this is a story that I started working on last winter, I want to say. And I've talked to dozens of people in that year or months since. So this includes past presidents of the BC Cancer Agency, 4 past presidents whose leadership together spans 25 years. So they have a very good idea of the management of the agency.
Right.
It includes oncologists, nurses, radiologists, patients. And together, they have painted this picture of a system that is very challenged right now, and those challenges can be traced back to decisions that were made many years ago. When you talk to the past presidents specifically, they will point to changes dating back to 2001. So can I go on?
Please.
I could ramble for
Yeah.
I can take up the whole show.
So it's the BC Liberals' fault in 2001, is what you're saying.
So if you ask Adrian Dix, but the point is that this is not something that happened because of the pandemic.
Yeah.
So the past presidents will say that a lot of this originated with a change in governance structure in 2001. So once upon a time, BC Cancer was its own thing. It had its own board of directors. Past presidents had a direct line to the Minister of Health. Any sort of issues, they could pick up the phone, call them, talk about it. Here are the things we need to do. Here are the investments that we need. In 2001, BC Cancer was moved under the purview of the newly created Provincial Health Services Authority.
Okay.
And with that came a whole bunch of additional layers of bureaucracy that the past presidents say impeded their ability to affect the change that they wanted to.
Interesting.
So one of the past presidents, for example, said when he was at the helm before this change in governance structure, they would make huge investments in recruiting nationally and internationally and investments in technology and emerging sciences. And then after this, there were all these budgetary constraints and layers of bureaucracy. And in his words, they went from the primary goal of excellence in cancer control in BC to making the medicine fit the budget.
Is there a particular stage in the cancer care treatment cycle that is particularly bottlenecked, or is it just delays and impediments throughout the process?
So there are several.
Okay.
So one big one is the wait to see an oncologist for the first time. So let's say you're lucky enough to have a family doctor and you go in with symptoms and you might have cancer. You're referred to an oncologist. Ideally, you get to see that oncologist in 2 weeks. That's the benchmark of acceptable waiting times generally.
Yeah.
In British Columbia, right now, only about 20% of people are able to see the oncologist for the first time within 2 weeks.
Whoa.
It's closer to 6 to 12 weeks, depending.
Oh my God. So exponentially longer.
Yes.
Yeah.
So instead of waiting weeks for that first consult, you're waiting months.
Yeah.
But I think the more important thing and the more significant thing is that when there's a delay at one stage in treatment, it compounds overall wait times.
Right.
So I talked to a gynecologic oncologist a few days ago, and she sort of illustrated this for me really well. So let's say I have a high-grade gynecologic cancer. I have been referred to an oncologist. Ideally, I would see the oncologist in a couple of weeks, but it might take 6 to 8 to 10 weeks, whatever.
Yeah.
So there are several things that could happen here. By the time I see the surgical oncologist, they might determine that surgery is not the appropriate best treatment right now. So I've waited 2 months to be told that this is not the right course of treatment. Another possibility is that in the 2 months that I've waited, my disease has progressed to the point that it's no longer a relatively simple surgery, that maybe I need chemo or radiation now. And in both of those, if I do need chemo or radiation, then I get into a different wait list and I have to wait 6, 8+ weeks for a medical oncologist or a radiation oncologist. So it's like I have to get back into another line. Or perhaps it's determined that I do need surgery. Then I need to get into an operating room, and the wait for that, according to the oncologist, is 8 to 10 weeks right now when it should be 2 weeks.
Wow.
So we're sitting here talking in the first week of October. I have a life-threatening cancer. It could be Valentine's Day before I get in for my surgery.
And this is ultimately going to cost lives at the end of the day.
Yeah.
Wow. Well, hey, Andrea, I appreciate you reporting on this. I know this is affecting a lot of British Columbians, and certainly I think there's a lot of demand for immediate action. So thank you so much for your time tonight.
Thank you so much for your interest. My pleasure.
Folks, that was Andrea Wu from the Globe and Mail. Be sure to follow her impactful work on a broad range of public health issues, including the province's COVID-19 response and the illicit drug poisoning crisis. Now, after some business, let's talk provincial politics. The BC Liberals may soon be called BC United. And you know what? I kind of like it. But it's worth asking why the party is finally pursuing a name change now and what this all represents. The Vice President of the BC Liberal Party, Caroline Elliott, will explain up next. I'm Mo Amir. This is VANCOLOUR.